Hello everyone, I am Dr. Ramya Nagaraj, a consultant dermatologist with over 10 years of experience helping patients achieve healthy and beautiful skin. Today we are diving deep into a very common yet commonly misunderstood skin condition called melasma. So if you are suffering from melasma or just wondering what it could be and how to treat it, this video is for you. We'll start with answering the first question, that is, what is melasma? Melasma is a chronic skin condition which has brownish or grayish skin patches on the face, commonly on cheeks, upper lip, chin area, or even on the eyebrows. And it can look something like these on various skin types. Since I said it is chronic, don't be warned. It is not dangerous, but it can affect self-confidence, social interactions, and can be frustrating for the patients who are suffering from it. Some other important points that we consider for melasma is it is most commonly seen in females with darker skin type, and some call it as a mask of pregnancy because it appears during the pregnancy due to hormonal changes. Now coming to next question, why does melasma happen? Melasma happens simply because of overproduction of a pigment called melanin, which is responsible for the color of our skin. Now one may ask why melanin is overproduced. The answer for this is there are certain triggers that can cause melanin overproduction. Coming to the first trigger, the sun exposure. This is the most important trigger. UV rays stimulate the melanocytes. Melanocytes are the cells which produce pigment called melanin, and you can see in this picture a melanocyte is producing melanin and transporting to the upper layer of the skin. And for sun exposure, we consider the cumulative sun exposure and sun damage throughout the patient life, not just the immediate sun exposure. Coming to the next trigger, that is the hormonal changes. Hormonal changes can happen during pregnancy with birth control pills or hormonal therapy or during perimenopausal time. Next trigger is certain medications. If you have melasma, your dermatologist will be checking your medication history to rule out any triggers from medications. The next trigger is heat and visible light. The heat from the stoves and IR radiation from the gadgets can also trigger or worsen melasma. Next, coming to another important trigger is it's your genetics. If someone in the first degree relative is having melasma, you're most likely to get it. But here, people with family history of melasma, if they take proper care, they may not get melasma. But if someone might not have family history, can still get melasma due to sun exposure and other triggers. The last trigger can be cosmetics or any topicals that can cause irritation on your skin, can cause or trigger or worsen the melasma. So now we have understood that melasma is caused by both external and internal factors, hence it becomes very tricky and dynamic pigmentation. Now some may wonder if the pigmentation that they have, is it melasma or not? For this to answer, you need to visit a dermatologist, and usually dermatologists can diagnose melasma with naked eye examination. But however, we use certain devices to determine the type of melasma, to know the extension of melasma, and to rule out any concomitant skin conditions. Dermoscopy is one such device that we use, which magnifies the lesion and shows the extent and the type of the melasma. Then we have the Woods lamp, which we use to examine the lesion, which can become accentuated or not accentuated. Based on that, we determine it is whether superficial or deep pigmentation. If it is a superficial pigmentation, we call it as a epidermal melasma. If it is a deep pigmentation, we call it as a dermal melasma. One can have a mix or combination of both this type. So after this, now we have understood that melasma can be different types and the triggers. Now coming to the treatment part. So based on the type of melasma, treatment varies. It depends upon the type of the skin that you have, type of melasma, your medical and medication history. So we have lot of treatment options that is available. But firstly, due to lot of misinformation out there, patients with melasma are using many of the OTC creams and serums that is recommended for any pigmentation. Mind you, I need to tell that these creams can cause more harm than good. So please avoid using such OTC creams and serums that is advised for pigmentation. Since we have understood it is a dynamic pigmentation, it is not just any simple pigmentation. There's a lot going on in your skin. You need to have a comprehensive and a long-term maintenance. When I say comprehensive, I mean we should consider all the triggers that is particularly applicable for you and manage it. And when I say a long-term treatment, since it is a chronic condition, we need a long-term plan. With the right approach, we can keep the melasma under control without the show of pigmentation. So now coming to the treatment option. First is sun protection, which is non-negotiable. We need to use broad spectrum, SPF 50 plus and PA 444 plus sunscreens. If it has IR radiation filters, even more better. Then a reapplication of sunscreen is a mandate even if you are indoors. If you're planning for vacations, oral sunscreen with antioxidants can be considered. Then other sun protective measures like seeking shade while being outdoors, using protective sun gears like hats, sunglasses and gloves wherever applicable is a must. Now some patients complain that sunscreens are messy, oily and not suitable for your skin. But here I must say that sunscreens have evolved so much that there is a sunscreen for every skin type. And if you visit your dermatologist, they will examine your skin and then prescribe a particular sunscreen that is suitable for your skin. Coming to the next line of treatment, it is a topical treatment, which is considered as a first line of treatment and also in combination of various procedures, also in the maintenance in a long-term plan. So there are various formulations like hydroquinone, kojic acid, vitamin C, retinoids, histamine. Dermatologists will prescribe these formulations based on your skin type. The next line of treatment is oral medications. We have formulations like tranexamic acid, which inhibit the melanin production, and other antioxidants like pycnogen, which are plant extract, which are beneficial in treatment of melasma. So these will be prescribed based on your medical history and your medication history. So now coming to the next line of treatment, that is procedures. We consider procedures long-standing cases if the pigmentation is not responding to the first line of treatment or if it is a deeper pigmentation. Procedures like chemical peels, where we use chemicals like glycolic acid, mandelic acid, which works on the basis of chemical rejuvenation, helps in clearing melasma. The other procedures are lasers. Lasers that we use are IPL, then low fluence Q-switch lasers, non-ablative fractional lasers, picosecond lasers. These are the treatment options that we have. And these work wonderfully by breaking the melanin pigment in your skin. Now next we have microneedling with various injectables like PRP and exosomes, and these will be considered based on your skin type. Then we have microneedling with various injectables like PRP and exosome, which works by the basis of collagen remodeling and collagen production. And these procedures will be added to your routine if you have deeper pigmentation. The cost of the treatment in Venkat Center varies anywhere between 3,000 to 10,000, keeping your budget in mind. The most important factors that we consider here is we combine various modalities of treatments. With this, keeping individual skin type and patient preferences. We have seen with this, we get better results and better patient satisfaction. This was in brief about melasma. I hope this video was helpful. Don't forget to come back here for more such expert skincare advices. If you like this video, please like this video, share and subscribe to our channel, Venkat Center for Aesthetic Health. Thank you.